Good morning, everyone, and thank you for joining our briefing today. As usual, we will have an update from Public Health, and then we're also going to hear about several things on the transportation front, in addition to a number of other announcements and meeting notices. But we will start with Doug Vagley from Public Health Madison Dane County for our update on COVID-19.
Thank you, Mayor, for the opportunity to speak today. It's really great when I get up here and give lots of good news, and that's what we have, is a lot of really good news. We're continuing to see the effects of increased vaccination administration in Dane County. It's reflected in the data. Our current 7-day average is 37 cases. Last week at that briefing, it was 49 cases per day. So we're really heading in the right direction. The rate of positivity is currently just 2%. That doesn't include the tests from the UW-Madison. Our hospitalizations also remain stable. Right now, we're averaging 39 people hospitalized. Last week, it was 37. Cases have nearly disappeared in our oldest populations of 70 plus. The same age group is also seeing sky-high vaccination rates above 90%. In the past month, we've also seen decreases in cases among the age group of 12 to 29 and 40 to 49, while all other age groups are remaining stable. So, as I said, our vaccine administration in Dane County continues to just be very impressive. In fact, I was looking at the New York Times Vax Tracker today, and it places Dane County as one of the top counties in the United States for counties our size in terms of our vaccination rate. Super impressive. It's just a testament to the citizens and residents of Dane County. We have 581,000 doses that have been administered in Dane County, and we reached a new milestone this week with 50% of our county completing the vaccine series. 51.4% to be exact. That will continue to increase as we right now are administering a lot of second doses at the Alliant Energy Center. 61.8% of our population has at least one dose. So we continue to do remarkably well there. And then, as I mentioned earlier, we have an impressive vaccine coverage in our 65 plus population. 94.8% have one dose and 90% have completed the series. Another bright sign is that the vaccination rates with our 16 and 17-year-olds are rapidly increasing. 58.9% have at least one dose. So hats off to those the younger population in Dane County at getting their vaccinations. We're hopeful that the expansion of eligibility age groups, which I'll discuss in a little bit, will help address the racial disparities that we're seeing in the vaccination data. So speaking of younger age groups, today is a great day for all of us in the fight against COVID, and the recent announcement from the CDC and then DHS last evening to allow 12 to 15-year-olds to receive the Pfizer vaccine. So that's super news. It's great. It adds about 25 to 30,000 people in our county that can now be vaccinated and continue to help us achieve that herd immunity that we're looking for. So if you're a parent looking to make an appointment for your child, we're asking you to look at your local doctor's office, your local pharmacies, pop-up clinics. There's several pop-up clinics, which I'll get to in a little bit today, or make an appointment at the Alliant Energy Center. We did save some appointments. However, I work next to a call center person, and it sounded like those appointments may be filling up rather quickly. We will, at Dane County vaccination sites, be asking for parental consent. We would like the child and the parent to both consent to receiving the vaccine. And obviously, we'd like a parent available either on site or via the telephone so that we can gain consent for the 12 to 15-year-old population. We do not accept written consent. One thing to keep in mind with this large group now eligible, we're encouraging people to make an appointment at the Alliant Energy Center. As I said, I think that a lot of our appointments are booked. We will have capacity next week for sure. We'll have additional vaccine. I know I was up here many times saying that we just don't have the supply of vaccines. Now we have the supply of vaccines. Now it's just a matter of the capacity and the amount of vaccine that we can deliver with us and our local partners. You can go to the AEC without an appointment. It will be a long wait. And there is a potential that we may run out of vaccine, and then we would place an order to DHS to get more vaccine, so we can always get more vaccine in, but that is a process. Alliant Energy Center, just a reminder, is open Tuesdays and Thursdays from noon to 7, Fridays and Saturdays and Wednesdays from 8 to 3. Also, just a quick note, we are going to be closing our testing sites and our vaccination sites in observance of Memorial Day, so we will be closed on Saturday, May 29th, both for vaccination and for testing. There still may be vaccination available, so please look at our website where we have all different clinics that are listed, as well as different options for you to get the vaccine. So today, it's a great day with a lot of different things going on in terms of mobile vaccine clinics. We're hosting a clinic this afternoon in Sun Prairie. It runs from 4 to 8 at the Elements Apartments at 102 Park Circle in Sun Prairie. Our vaccinators will be set up in the parking lot in front of the clubhouse. It's a walk-up clinic, no appointment required. Everyone 12 and older is welcome to come and get their free COVID-19 vaccine. No IDs required. We'll have a supply of both Pfizer and Johnson & Johnson vaccine available if you'd prefer the one dose. However, that's not available for children under 18. There's also a lot of different vaccination clinics going on today at the News 3 Now studios on Raymond Road and Lake Farm County Park that's starting right now. The clinics are run by SSM Health and they'll continue until 7 p.m. Stop by, again, get your vaccination for free, no documentation needed. People 12 and up are welcome. News 3 Now is also holding a phone bank, so if you have questions, if you're hesitant and want to talk to someone about the vaccines, please give us a call. We're there to answer any questions in English and Spanish. There's also several other pop-up clinics that are going on throughout the day in the area today. And we'll have more information on our Facebook page. I think I could have swore there's like 5 or 6 different clinics going on today. So there's plenty of opportunity for people to get out there and get the vaccination and continue this, just this awesome momentum that we have going in Dane County to ensure that we can stop the spread of COVID-19. Of course, as always, until you are vaccinated, actually, even if you are vaccinated, we are still encouraging the use of masks and requiring the use of masks, and then also to ensure that you're distancing and trying to avoid gatherings as much as possible. That's all I had. Thank you.
Thanks, Doug. Lots of opportunities to get vaccinated if you haven't already, and particularly for those 12 to 15-year-olds. Very exciting that they are eligible now, and encourage everybody to make it a family affair and get the whole family vaccinated. All right, next we're going to hear from Renee Callaway, who's our Ped Bike Coordinator here in Madison, with some very good news.
All right, thank you, Mayor. And it is very exciting. It feels like a day of great news here today.
And my news today is that the National Walk Friendly Communities Program has awarded the City of Madison its gold level designation. So Madison will be the first city in Wisconsin to earn the gold level Walk Friendly Community designation and is one of only 16 cities throughout the United States that is receiving that gold designation. And this would not have been possible without many years of staff across city departments working together along with our community partners and our residents to plan and build walkable neighborhoods, walkable streets, accessible transit stops, schools, and parks, and develop walkable neighborhood plans and support walkable developments. The Walk Friendly Community Program recognized us particularly for a few things, including the high level of people who report commuting by walking on the census, which is nearly 10%, as well as our city's commitment to safety, working on reducing speeds for motor vehicles, improving street crossings, as well as our extensive sidewalk network that we are lucky to have here in the city of Madison. They also mentioned our robust crossing guard program, along with encouragement events that we have, like our Walk and Roll Challenge for schools and our Walktober event that just encourages people to get out and walk for any reason, be it health or for transportation, or just to get to know their neighborhood better. Now, however, there's always a however or a but. The work that we have to do to make a top city for walking is far from over. A great part about the Walk Friendly Community Program is that they're going to be providing us with some feedback, which can help serve as a roadmap as we work to improve and make our city even better. And I would like to say that the city must have safe walking for everyone, regardless of their age or their ability. And Madison has way too many streets that are difficult to cross, where drivers will not look for or yield to pedestrians, and too many streets that do not offer a safe way for a child to walk to school, to a friend's house, or to their neighborhood park. And there are too many places that remain inaccessible for our residents and visitors who have visual impairments or who use a wheelchair. So to improve our walk friendliness and make our city overall safer for people walking, we're committed to developing a complete and green streets plan that will help our city better design and build streets that are safer, more accessible, as well as more sustainable. We also will be completing our Vision Zero action plan with strategies and actions aimed at eliminating serious and fatal crashes by 2030. We see data that shows that only 4% of crashes are people walking and biking, which is great, but 27% of people who are killed or injured in our crashes are people walking and biking. And this must be addressed. So this year, we will be adding more of the rapid flash beacon lights throughout the city at difficult unsignalized crossings. We'll be improving crosswalk visibility at many locations throughout the city. We have traffic calming projects that we will be doing. We have some key sidewalks and paths that we will be adding, and we will be lowering the speed limits on a number of streets to also address safety. So as nice as it is to receive a gold level designation, and it is very nice, it's even more exciting to be able to build upon this designation, use the Walk Friendly Community Program feedback, and work on our upcoming planning efforts and make on-the-ground changes that truly make Madison safer and more accessible every day, every year. And so I look forward to continuing to work with staff across our departments who are great partners, as well as many community partners who are interested in these issues, as well as our residents, to ensure that everyone can enjoy walking in our city and that we will be earning a Platinum Walk Friendly Community designation in the not-too-distant future. Thank you.
Thanks, Renee, and congratulations to you and the whole team on the gold level recognition. I am also excited to be recognized, but eager to get to a platinum level. Next, we have our Transportation Director, Tom Lynch, who will be talking about a new program that we are introducing to better manage our transportation demand and to make our city even more friendly for pedestrians, transit users, and bicyclists. Tom?
Hello. So since 1970, the population in America has increased by about 60%. but our use of motor vehicles has increased 190%. So that's a threefold increase. So if you think about it, remember, just 2 years ago when you would be stuck on East Washington or University Avenue or on the Beltline, just with cars all around you. And with all that traffic, emissions have increased. In fact, right now, transportation is the highest contributor to carbon dioxide emissions in America. So we cannot get serious about climate change unless we get serious about transportation. Transportation demand management is a system of policies and procedures that seek to shift travel away from single occupancy vehicles to bicycles, walking, and bus transit. I've been a traffic engineer for over 30 years, and I'm going to just say for the last 40 or 50 years, what we've sought to do is when a development comes in, we've sought to expand the roadway network to accommodate the development. Transportation demand management flips that on its head, saying our transportation network is what it is. We don't have any more room to expand. So how can we have developments produce fewer trips, fewer motor vehicle trips? Transportation demand management has been around in the city for 20 years. It's in our zoning code, it's in our comprehensive plan, and it's also in our transportation plan. But there hasn't been a central unified place that gives developers and residents and businesses a choice and an understanding of what would be required and how they can make a meaningful difference. We are proposing a transportation demand management that provides clarity to developers so that they understand what types of things they can do to reduce single occupancy vehicle trips, such as bike racks or showers in their office building or providing subsidized transit passes. And it also provides employees and residents with more choices. You won't be forced necessarily to get to work in a car because that's the only way you can get to work. There'll be other options for you that are cost effective. We're basically asking developers in our community to put the same investment in all of our modes as we currently put into our auto-dominated mode. Right now, about 2/3 of all work trips are single occupancy vehicle trips, which means we get in the car and we go. So 2 out of 3 people, that's how they get to work. But that doesn't have to be that way. Many communities have been able to shift that so that maybe only half, or even less than half, have to use a car to get to work, and instead they can use a bus, bike, or walk. This will have a lot of different community benefits. For example, what neighborhood does not complain about speeding, traffic congestion, noise, and air pollution? What we can do is we can continue to grow in a sustainable way and mitigate a lot of the negative impacts associated with the traffic by shifting these modes. Today, at a planning commission meeting with the Transportation Planning and Policy Board, we're going to unveil a program, a draft program that we would like to work with stakeholders, residents, and the development community on that gets serious about reducing our auto travel. It's based on transportation demand management programs that have occurred throughout the United States. Places like Minneapolis, San Francisco, Oakland, Arlington County, Virginia. The way it works is a developer will go to a very standardized chart, see what types of mitigation points they would need, and then they have a choice of over 35 options to invest in transportation options that don't involve a car. By doing that, it provides them clarity as they go through the approval process. It also will provide neighboring residents the benefit of having I'm going to just say a responsible, environmentally responsible neighbor and development close by. Transportation demand management programs have been successful throughout the United States. Some really model communities include Cambridge, Massachusetts. Their TDM program reduced single occupancy vehicle trips from 55% in 1990 to 39% in 2018. That's a significant change. Arlington, Virginia has a long-standing and comprehensive program. The TDM for developments for them saw a vehicle miles traveled reduction of 38% from 2008 to 2019. You think about that. The vehicle miles traveled in that county per day was reduced by 38%. That's a significant change, and that makes a significant difference in climate. So we look forward to working with the development community, the Planning Commission, the Transportation Planning and Policy Board, and the residents and other stakeholders as we forge this program that makes a real difference in our transportation options and in our climate. You can learn more about this on the transportation website under initiatives. Thank you.
Thank you, Tom. I'm very excited about this program. It's something that staff have been working on for some years and that I actually had been working on before I was elected to bring to Madison. So I'm really grateful for all the hours that have gone into it, and I'm excited to bring it to Plan Commission and the transportation committees, and hopeful that we can get this implemented and working for our city in the very near future. So I think there is a theme for the week, and that theme is good news, because what I have is more good news. First, I want to congratulate and recognize our Public Health Director, Janelle Heinrich, for being awarded and recognized as the Wisconsin Association of Local Health Departments and Boards 2021 Health Officer of the Year. If there's ever a year to be Health Officer of the Year, this is it. It's been an incredibly difficult year for our public health folks all across the state and the country and the world. And so I'm really want to congratulate Janelle on being recognized by her colleagues, and add my thanks to theirs. She and the whole public health team have done a really great job, and Janelle's been a real leader throughout the entire pandemic. One of the nominations mentioned how good a collaborator she is across different levels of government, and how much she and the whole public health team center equity in their work. And I really appreciate those aspects as well. So congratulations, Janelle. More good news, the public libraries are set to reopen on May 24th. The Public Library Board voted to reopen the libraries and to increase the number of services that are available in person. So you can now browse in our libraries again after the 24th. There will be self-pickup holds and also checkout and access to the basic desk services in person at our libraries. Libraries are a critical part of our community. They provide free and equitable access to resources and experiences, and library staff have just done a tremendous job of trying to maintain as much access as possible during the pandemic. But it's really great to know that we're now at the point where we all feel safe coming back in person to our libraries. So starting on May 24th, all libraries except for Monroe Street will be open weekdays 10 a.m. to 6 p.m. and Saturdays noon to 5. And the Monroe Street Library will be open Monday, Tuesday, and Friday from 10 a.m. to 6 p.m. And note that because of the smaller footprint at Monroe, there will not be computer service available. We also have the Dream Bus going around the community to a number of places, and a little bit more about that in a minute. But if you're looking for the Dream Bus, you can find their schedule online at madpl.org/dream-bus. And if you have questions, the central reference number for the libraries is 608-266-6300. That number is staffed 10 to 6 on weekdays and 12 to 5 on Saturdays. I do just want to note that if you are going to visit your libraries in person after the 24th, we still will be asking visitors 5 and above to wear a mask or face covering, to keep that 6 foot of distance between folks not in the same household, to wash hands and sanitize regularly. There will not be any eating or drinking allowed in the libraries, and they will be monitoring capacity just to make sure that we're meeting the current public health guidelines. We do expect to continue to expand public library services throughout the rest of the year as the public health conditions and staffing levels allow. So if you want to plan your visit or check on what's available at any given time, do visit madisonpubliclibrary.org or call 608-266-6300. We are going to phase out curbside pickup starting on May 24th because you'll be able to go pick up inside. And if you have any other questions about what's available, again, madisonpubliclibrary.org. Just a reminder that we still do have an extensive collection of audio and ebooks, which you can see at madpl.org/ebooks. And a big thank you to all of our librarians for all the work that you've done over the year. In other good library news, our library team is collaborating with the Forward Madison Football Club, announcing a strategic partnership to promote literacy and support young writers in Madison. I'm very excited about this. It's a great group of folks coming together. And so one of the ways that they're collaborating is that the Dream Bus, which is our library's mobile library, will be stationed outside Breese Stevens Field to help fans get signed up for library cards, offer browsing of materials, and hand out swag, always good, for the We Read program. In fact, there's going to be a special limited edition We Read in a Flock sticker for kids and families to enjoy. So Forward Madison Football Club, the Flock, and Madison Public Library are formalizing this partnership to bring the Dream Bus to Forward games, but also to encourage young writers in the community by introducing a young writers competition. The We Read Youth Voices Young Writers Contest is focused on writers aged 18 and under who have a story to share. The theme of the contest will be teamwork. But that's not limited to sports. Teamwork can mean a lot of things. So any short story, poem, song, rap, or creative written expression of people working collaboratively for a common goal is encouraged. Contest begins June 12th and closes September 17th, with winners announced in October as part of the Wisconsin Book Festival. And they will be honored at one of the final games of the season in October. You can visit madpl.org/youth voices for submission details beginning in early June. So young writers, get your right on and make sure that you submit to this contest. You can learn more about the partnership at madpl.org/forward. And I want to thank the Flock and the Mingos for working with our libraries. It's a great collaboration. Also in spring news, we talked a little bit about this last week, but just a reminder that we've got lots of resources to get involved with rain gardens or the Adopt a Median program. We've got the Roger Bannerman Rain Garden program. And we encourage folks to plant rain gardens wherever possible and appropriate. And so a rain garden is a garden of native shrubs, perennials, and flowers planted in a shallow depression, or built on a natural slope. And it's designed to capture and infiltrate water into the ground where it falls, rather than letting it run off into our streets and to our lakes. It's a great option for localized stormwater management. If you want to learn more about rain gardens, you can visit cityofmadison.com/engineering/stormwater/rain gardens. Our Adopt a Median program is a way for community members to help us beautify the community by taking care of existing traffic calming circles and medians. There's about 225 of these that are available or that are in residential streets. About 65 are adopted, and the remaining 160 are either available or are being maintained anonymously. Thank you to all you anonymous gardeners out there. So if you are interested in wondering if a median near you or a traffic circle near you is available, anybody can apply, and the city will support you through the process. And you should visit cityofmadison.com/engineering/adopt-a-median for more information. And thanks to everybody who's doing this or will consider it. So now's the time to be planting, so get on that. Also from engineering, they are doing a survey to help us prioritize our flood mitigation projects. They've been doing a lot of work over the past couple of years to map our watersheds and identify places where flooding is an issue and how that can be mitigated by either green or gray infrastructure. But there's a lot of work to be done, and obviously our time and resources are limited. So we want to talk with the community about how to best prioritize these flood mitigation projects. So to that end, engineering has got a survey out, and you can take that survey at surveymonkey.com/r, this is a little crazy, GQWMMQ5, or you could just check the engineering website, citymadison.com/engineering. All right, and then our last piece of good news for today, I am delighted to announce that our Greater Madison Music City project has received a grant, an Our Town grant from the National Endowment for the Arts. The Greater Madison Music City project is working to create an equitable music economy in our region. And this grant is one of 63 grants nationwide from the NEA through this program. I'm really excited about the work that's being done, and I want to thank the NEA for investing in Madison's music scene and helping us to make it as equitable and entertaining as it can possibly be. And thanks to the city staff who wrote the grant application and are doing the work. As usual, I have a list of community resources for folks to take advantage of, and ask for anybody on the briefing to help us publicize these resources, starting with the United Way's 211 line, which can help you identify emergency food options, housing options, connection to social services, and more. You can call 211 or text your zip code to 898-211. The city also has a financial resource hotline to help folks navigate the financial issues due to the COVID-19 pandemic. You can learn more at citymadison.com/financial hotline, or call the libraries at 608-266-6300 to get an appointment. We also have a housing helpline. If you're homeless or in danger of losing housing, call 608-264-0549 or email housinginfo@cityofmadison.com. The State Public Service Commission has an internet and phone helpline, which is 608-267-3595. If you need help finding childcare, call 608-216-7022. The healthcare.gov marketplace is still open for people who do not have health insurance. Strongly encourage you to check it out. And if you need help navigating the marketplace, you can call 211 or visit wiscovered.com to get some help navigating and finding the right plan for you. If you need assistance paying your 2021 healthcare premium through the marketplace, you might be eligible for our Health Connect program here in Madison-Dane County. And you can again call 211 for information or visit unitedwaydanecounty.org/healthconnect for eligibility information and assistance. And thanks to the United Way for managing that program. It's a great support. Again, get health insurance if you don't have it. If you need a computer to navigate any of these resources, which you very well may, again, our libraries do have computers available, and that's on a first-come, first-served basis at 8 of the 9 locations. Again, Monroe Street Library doesn't have computers available right now. And you can make reservations by calling 608-266-6300 or visit madpl.org/computers. All of these resources and more are available at cityofmadison.com. Click on the community resources link. And all of the announcements that I've made and more are on our blog. That's cityofmadison.com/mayor/blog. You can find a lot more information, and you can sign up to get the blog in your email. Meetings coming up. Today at 2:30, the Early Childhood Care and Education Committee meets. At 4:30, the Community Development Authority meets. At 5, Equal Opportunities Commission meets. Also at 5, the Plan Commission. We'll be talking about the transportation demand management work. And at 5, the Police Civilian Oversight Board will meet. And on Monday, the 17th at 5, the Landmarks Commission will meet. Also at 5, the Transportation Policy and Planning Board will meet. And at 5:30, the City County Homeless Issues Committee will meet. On Tuesday, the 18th at 4:30, the Common Council Executive Committee will meet. And at 6:30, the Common Council will meet. And on Wednesday, the 19th at 4:30, the Board of Public Works will meet. At 5, the Economic Development Committee will meet. At 5:30, the Alcohol License Review Committee will meet. And at 5:30, the Greater Madison Metropolitan Planning Organization Citizen Advisory Committee will meet. And that is what I have this week. Linda, do we have questions?
Yes, we do. And all our questions is for public health.
All right. We will have Doug back up to answer some questions on public health.
Good morning, Doug. The first set of questions says, how close is Dane County to removing more pandemic restrictions? Milwaukee announced its easing rules June 15th. How long will Dane County keep its mask order? Other areas like Waukesha lifted theirs, and several school districts around the state have also removed that pandemic restriction.
Excellent questions. I guess I'd just first like to start that we've had 16 emergency orders, and there is a pattern to the orders. If we take a look at it, we review and put new orders out every 28 days. Normally, we try to release those orders 1 week in advance. We will have orders that will be expiring June 5th. So I think that we could look to see if there would be some guidance coming out the week before June 5th. That being said, we're still going to continue to look at our number of cases that we have, our percent positivity, and we'll look at the amount of people that are vaccinated to help us determine where we'll go with those restrictions and how that next order will read. So while I can't answer directly, I would just say that, all of our signs are pointing into the direction that there could potentially be some changes in the next order. The mask mandate is a different situation as well. And I know that there's been some movement on the CDC in regards to the masking and the requirements for masking. Of course, we know that they did remove the requirement for outdoor masking. They're working on new guidelines right now. And again, Public Health Madison Dane County will be reviewing those guidelines. We'll be looking at the science and the studies that our data team is always constantly reviewing. And then we'll be looking at our local numbers and to see where we're at with that. All of those decisions and recommendations will be put together, and that information will be used to determine where our mask mandate will go forward from here.
Thank you. The next sets of questions is, how is public health verifying ages of children for vaccination? And is public health planning any special clinics for 12 to 15-year-olds to get vaccinated, or any changes to set up at the Alliance Energy Center?
Oh, great questions. Great questions. So age verification is done via the Wisconsin Immunization Registry. So when you come in and you give us your child's name and birth date, it's looked up on the computer. And that tells us that that person is of age to be vaccinated. And of course, now we'll go all the way down to 12 years old, so adding a lot more people. But age is verified using the Wisconsin Immunization Registry. So the Alliant, we did this week hold back appointments, just hoping in anticipation that the announcement with the 12 to 15-year-olds would be made. It was made, and those appointments were snapped up pretty quick. Next week, we will have appointments available again, and we will have capacity to take on the 12 and 15-year-old population that wants to get vaccinated. Also, it's always a good time to remind everybody that, Public Health runs the Alliant Energy Center, but there are so many other partners in Dane County that are helping us to get everybody vaccinated in a timely manner. So while there will be appointments next week, and we will have capacity next week at AEC for 12 to 15-year-olds, if your desire is to get vaccinated prior to that, I would again ask that you look to local pharmacies, healthcare providers, or the variety of pop-up clinics today. I mean, there's just a tremendous amount of clinics going on today, and we'll be continuing throughout the next few weeks, where we'll just be setting up and making it as easy and as convenient for people to get that vaccination as possible.
Thank you so much. And those are the questions I have for you today.
Great, thank you. Thank you, Mayor.
Thanks, Doug. And I just want to remind folks that the way out of all of this is the vaccinations, right? So first you get the vaccination, then you get the concerts. And there's a number of ways that you can get more information. Certainly, if you visit publichealthmdc.com, they have a wealth of information about vaccination, particularly at the Alliant Energy Center, but also other sources. And I did just want to give folks the number for the Channel 3000 phone bank today. Again, they are having clinics at a couple of different places. If you have questions about vaccination, you can call 608-274-4000 until 7 p.m. today and get your questions answered. And that is what we've got for the week. So thank you all for tuning in. Appreciate you. Have a great week, and we will see you next time.